Hello, this video is for Informatics Nursing Quality Indicators Nursing 4040 Assessment 4. Good afternoon, everyone. My name is Slavia Shrey. I am a registered nurse at Green Path Skilled Nursing Facility and a member of the Quality Improvement Council. During this presentation, I will be your nurse educator, sensitive quality indicators, and how help nurses improve patient outcomes. We evaluate our facility services to ensure our patients receive high quality care. I will utilize the National Database of Nursing Quality Indicators, NDNQI, to compare the effectiveness of our skilled nursing facility to that of other SNFs. The American Nurses Association established the NDNQI database in 1998 as a part of its safety and quality campaign. This database contains evidence for evaluating the connections between nursing care and patient outcomes. The information provided by NDNQI covers several nursing sensitive indicators, structure, processes, and patient outcomes. First, the system consists of nurses and their education and skills. The process is interventions provided. Lastly, the product is whether the interventions were successful. The nursing sensitive indicators cover subjects like patient falls, sexual assault reported on psychiatric patients, and pressure injury prevalence. Nursing sensitive quality indicators are data reported to the NDNQI to help hospital improvement patient outcomes. In today's education seminar, I will discuss the nursing sensitive indicators that affects the patients in our facility the most: pressure injuries. I will examine ways to prevent pressure injuries in a subacute facilities. Pressure injuries, or PIs, formerly known as pressure ulcers, are painfully and expensive, reduce the quality of life, and increase mortalities. When it comes to pressure injuries, prevention is vital. Nurses must monitor the patient's risk factors for developing pressure injuries. The most two common ways nurses assess pressure injuries risk factors is by using the Braden scale and the Norton scales. The Braden scale measures patients' risk for 6 subscales: mobility, friction and shear, sensory perception, nutrition, activity, and moisture. The Norton scale is based on 5 primary risk factors for developing pressure injuries: physical health, mental health, activities, mobility, and incontinence. Sadin and Bilowowicz 2020 affirmed that even though these tools can be used to make predictions, they were made based on clinical decisions rather than empirical evidence. The predictors in these scales may have a lot in common with the weights may not be the best. New nurses need to assess their patients for risk of developing pressure injuries and use interventions and supplies to minimize the occurrence. When pressure injuries occur, they negatively affect patient health outcomes. Patients in a skilled nursing facility, are especially at risk because they are older with poor mobility and often have poor nutrition. Nurses must use waffle mattresses to aid with positioning every 2 hours. Optifoam supply should be applied on bony prominences, and incontinence patients must be kept dry. Nurses should also work with registered dietitians to ensure that the high-risk patients have their nutrition needs met. Pressure injuries can lead to other health issues, such as infection or sepsis. So pressure injuries can become so bad that patients may need extended stays in hospitals or surgery. At Green Skilled Nursing Facility, we have well-defined plan for collecting and using patient injury data. The Hospital Health System Association of Pennsylvania estimated the pressure injuries are 9.1 billion to 11.9 billion annually in the United States. Individual patients' care range from $20,900 and $151,700 per pressure injury. Pressure injuries prevention is collaborative effort. All interdisciplinary team members can help minimize their occurrence. During the initial assessment, the nurse can utilize the electronic medical record to document patients' risks for using the braiding scale, to rate risk factors getting pressure injuries. For example, an older patient with mobilities that affects their mental cognition and mobility are a high risk for developing pressure injuries. Existing pressure injuries are recorded on the EMR as an incident reporting, so the hospital and long-term care facilities can assess their patterns and use evidence-based practice to prevent and treat them. Interdisciplinary team members have access to patients' charts and can work with nurses to minimize risks and treat current pressure injuries. Photos can be taken and uploaded to the system to determine if the interventions have been successful or if more aggressive treatment is required. Some possible interventions include using an air mattress, a wound care, increased caloric intake, or surgery. When pressure injuries in the unit are discovered, the skilled nursing facility compares pressure injury data to the NDN-QI database to identify areas for improvement. In conclusion, nurses have a critical part in preventing and treating pressure injuries. Nurses must assess their patients thoroughly to determine which ones are high risk for developing pressure injuries, such as patients with mobility issues, altered mental status, and conditions that might make them incontinent. Nurses should document and take photos of the current pressure injuries so that we can know if the injury occurred at our facility or somewhere else. Good documentations helps staff to take collaborative steps to improve pressure injuries from occurring. Reduce and treating pressure injuries must be a collaborative effort, require continuous treatment, communication, and documentation. Our facility can improve patient-centered care and improve patient health outcomes with collaborative culture. Thank you.